Hi everyone, Dr. Brian Steiner here at Wilkins Spinal Care in Mount Pleasant, Pennsylvania. This week we are going to talk about an examination. And when I mean an examination, I mean a thorough examination. So first things first, just to let you know, any new patient that walks into this door, everybody gets a thorough examination. There is no ifs, ands, or buts. We won't treat patients without an exam because we want to make sure we know what is going on with the patient's case before we actually do it. So think about going to a dentist, think about going to another doctor that has done an exam on you. A dentist isn't going to treat your teeth without x-rays. They're not going to treat you without looking at things. PCP, they're going to do the same thing. They're not going to treat you without knowing some things. Now let me explain the difference between an examination and a thorough examination. So our office does a thorough examination where other offices, hopefully they don't, but I do hear stories that they just do a real quick 2-minute exam, just like a real quick reflex, blood pressure, done. That's an exam. That's not a thorough examination. A thorough examination is what we do here at our office. First thing we do with patients is we do x-rays on them. I'll go through x-rays in another video, another blog later down. But today I'm going to focus directly on the examination. So our examination consists of 3 different components: vitals, neurological, and orthopedic. Okay, so the first one, vitals, that's just your routine blood pressure, pulse, oxygen levels here, height, weight, temperature, all those types of things. Neurological now, there's a couple different components to neurological. Reflexes, so arms, hands, feet, depending on what case you are. If you're a low back case, we're going to do a low back exam, so we'll do your knees, your feet. Or if you're a neck case, we'll do your elbows, your biceps, triceps, brachioradialis reflex. Next thing, sensation. So sensation is going to determine more of a neurological finding too, because that tells us right there, is a nerve not working properly or is it working just fine? If someone doesn't feel something, if there's numbness, if there's tingling, that tells us there's more of a nerve issue. Last thing is muscle strength. We check your muscle strength as well. We can do it a few different ways. We have a little device up here. I don't use it very much. That's for someone who's severely neurological disorder. But we do muscle testing. So we check resistance. So if you're a low back case with your legs, we check your resistance, extension, flexion, arms, up, down, left, right. We want you to resist. We want to see how strong those muscles are. So those are the neurological testing. The last part is the orthopedic testing. The orthopedic testing will give us even more of a finding if you're a chiropractic patient, a decompression patient, or a neuropathy patient. So in orthopedic testing, what I do and what we do is we bring your back, we bring your legs or arms, depending on what type of an exam it is, through different ranges of motions. We do different tests that we were taught in school to see if it elicits any pain. And what we tell the patients to do is tell us, is there pain here? And if there is pain, is it staying localized? Is it going down the arms, hands, and fingers? Is it going down the knees, hips, toes, anywhere down that area? That helps us determine, listen, this is an issue. That helps us determine, do we need to do more of an invasive type of procedure with you other than chiropractic, decompression, neuropathy? That is the true definition of a thorough examination. We do these examinations because we need to know exactly what's wrong with the patient, and we need to know exactly what we need to do in order to get the patient done. And that's why we perform these exams. If we don't perform these exams, we don't know. It's all blindsided, and we don't want you to be blindsided with care. A lot of patients, unfortunately, have come in here and they said, a chiropractor has never done an exam on me. They've never done x-rays. And then when they walk out of here, it's like, this is the most thorough place I've ever been to. That's our goal. We wish every chiropractor would do it, but we know that not every chiropractor does it. We want to be the people to help you. We want to be the people to get you better. We want to be that people to give you the care that you deserve and the care that you want. So that's all I have for you today on the examination. For the next couple weeks, I'm going to talk a little bit about different procedures we do around the office here. Next week, I'm actually going to go through a report of findings with you. So what I mean by a report of findings is after the patient has done their exam, after their initial visit. The next visit they come in, which is usually the next day, is their report of findings. So we go through everything we do with them, x-rays, exams, but I'll go into more on that next week. If you have any questions, please don't hesitate to reach out to us. I'd be happy to answer any questions for you. Other than that, you guys have a great day and stay safe out there.